Good morning, bonjour à tous. Thank you for joining us for today's special media availability on the seasonal influenza, also known as the flu. Merci de vous joindre à ce point de presse au sujet de la grippe saisonnière. Before we begin, a few reminders. Please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please use the speaker view instead of gallery, and that button is located on the top right of your screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez aussi changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite. For reporters with accessibility needs, you can pin Andrea, the ASL interpreter, or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler la vidéo de Geneviève, l'interprète LSQ, ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Dr. Trevor Arnason, Associate Medical Officer of Health at Ottawa Public Health, and Marie-Claude Turcotte, Program Manager of Immunization at OPH. Nos porte-paroles aujourd'hui sont le Dr. Trevor Arnason, médecin adjoint en santé publique à Santé publique Ottawa, et Marie-Claude Turcotte, gestionnaire du programme d'immunisation à Santé publique Ottawa. Je passe donc maintenant la parole au médecin adjoint en santé publique. Please go ahead, Dr. Arnason.
Thank you. Getting the flu vaccine is essential every year, but given the current COVID-19 pandemic, it is of utmost importance during the 2020-2021 influenza season. Collectively, we must work together to protect our most vulnerable and ensure that we do not overwhelm our healthcare system. If you don't normally get a flu vaccine, please get one this year. Adequate levels of influenza vaccination in our community will help to protect our vulnerable population and keep flu-related hospitalization and admissions low. Si vous ne vous faites pas vacciner contre la grippe saisonnière normalement, faites-vous vacciner cette année. Des niveaux adéquats de vaccination antigrippale dans notre communauté aideront à protéger nos populations les plus vulnérables et à maintenir un faible taux d'hospitalisation lié à la grippe. When more people get the flu vaccine, the odds of the flu virus spreading goes down. Anyone aged 6 months and older who lives, works, or attends school in Ontario is eligible to receive the publicly funded flu vaccine. Toute personne âgée de 6 mois et plus qui vit, travaille ou fréquente une école en Ontario est admissible au vaccin antigrippal financé par les fonds publics. There are 2 flu vaccines that will be available to the public this year. The Quadrivalent influenza vaccines, which covers against 4 strains of the flu virus, will be available for individuals over 6 months of age. And the high-dose trivalent influenza vaccine will be available again this year as an option for individuals who are 65 years old and over. This year, there are going to be several ways residents of Ottawa can access the flu vaccine. First, by making an appointment with your family doctor or other primary care provider. Secondly, by visiting a participating pharmacy. And lastly, by making an appointment at an Ottawa Public Health flu clinic, which my colleague, Marie-Claude, will be providing an update about those clinics in a moment. Cette année, les résidents peuvent accéder au vaccin antigrippal de plusieurs façons, en prenant rendez-vous avec votre médecin de famille ou un autre fournisseur de soins primaires, en visitant une pharmacie participante, ou en prenant rendez-vous dans une clinique de vaccination de santé publique à Ottawa. Ma collègue Marie-Claude fera le point sur ces cliniques. We anticipate the level of interest in this year's flu vaccines to be high, which is good news. OPH is pleased to hear that the province has purchased more doses this year in anticipation of an increase in demand. Due to the COVID-19 pandemic, vaccines will roll out steadily through the fall to ensure it can be delivered with appropriate precautions in place. Influenza season does not typically begin in Ontario until late November or December, and there will be many opportunities to get a flu vaccine in the coming weeks. New for this influenza season, OPH is partnering with physicians and primary care organizations to offer joint clinics where there will be an opportunity to immunize large numbers of patients in an OPH. This is meant to help address challenges some physicians and primary care providers face in delivering influenza vaccine in their office due to lack of space to allow for physical distancing. Pharmacies, as in past years, continue to receive their vaccine supply directly from the province. It's important to note that symptoms of the flu can be similar to those of COVID-19. Ottawa Public Health continues to encourage anyone who is exhibiting symptoms of COVID-19 to present for COVID testing. Please do not get your flu vaccine when you are feeling unwell with symptoms of flu or COVID-19 for the protection of the healthcare providers. Ottawa is currently at the highest level of alert for COVID-19, and it is critically important that we all follow public health measures, including wearing a mask, physical distancing, self-isolating when ill, and exercising proper hand hygiene. Fortunately, all of these measures will also be very effective in preventing the transmission of influenza. I encourage all residents to make an informed decision about getting the flu vaccine this year. Credible sources of information are available to help you make this decision. Whether it's to protect yourself, a loved one, or those who are most at risk in the community, I encourage you to find your reason to get the flu vaccine this season. J'encourage tous les résidents à prendre une décision éclairée quant à la vaccination contre la grippe cette année. Les sources d'informations crédibles sont disponibles pour vous aider à prendre cette décision. Que ce soit pour vous protéger un être cher ou ceux qui sont le plus à risque dans notre communauté. Je vous encourage à trouver votre raison de vous faire vacciner contre la grippe cette saison. To find out more about this year's influenza vaccines, please visit ottawapublichealth.ca/flu. Now I'll hand it over to Marie-Claude Turcotte.
Thank you. Merci. Good morning. Ottawa Public Health's goals with this year's flu clinics are to ensure the safety of the public and our staff while COVID-19 is present in our community, and to encourage all residents to get the vaccine. This year's clinics will include COVID-19 infection prevention and control measures, such as screening staff, volunteers, and clients for illness or exposure to COVID-19, physical distancing in terms of clinic layout and the number of clients allowed in the clinic at any given time, personal protective equipment for staff and nurses, increase environmental cleaning, the use of an online appointment system to control the client flow, and avoid crowding, and enhance communication. Ottawa Public Health will be offering flu clinics at 6 fixed locations around the city to members of the public. Santé publique Ottawa offrira des cliniques de vaccination aux membres du public dans 6 lieux fixes de la ville. These clinics will operate 7 days a week, including evenings and weekends. The 6 clinic locations are Notre-Dame-des-Champs Community Hall in Barrhaven, Ottawa Public Library, Orleans Branch, the Lansdowne Horticulture Building in the Glebe, Mary Pitt Center in Nepean, Chapman Mills Community Building in Barrhaven, and Eva James Memorial Center in Canada. To prevent crowding and lineups, Ottawa Public Health cannot accommodate walk-ins at the clinics. Afin de prévenir le surpeuplement et les files d'attente, Santé publique Ottawa ne peut accueillir les personnes sans rendez-vous dans les cliniques. Residents can book their appointments online at ottawapublichealth.ca/flu or can call our information center at 613-580-6744. Appointments will run from 9:40 a.m. to 7:30 p.m. Les résidents peuvent prendre leur rendez-vous en ligne à santépubliqueottawa.ca/grippe ou ils peuvent appeler notre centre d'information au 613-580-6744. Les rendez-vous auront lieu à partir de 9h40 et jusqu'à 19h30. Ottawa Public Health's flu clinic will begin on October 29th. Online booking will be available starting today, October 22nd, at noon. Les cliniques commenceront le 29 octobre. La réservation en ligne sera disponible à partir d'aujourd'hui, le 22 octobre à midi. We anticipate that there will be a lot of interest this year for flu clinics. If you're not able to book an appointment right away, please be assured that Ottawa Public Health will be releasing more appointments each week. The goal is to steadily increase the number of residents who are immunized. This will be a gradual process in the coming weeks and months. To help residents know what to expect at the flu clinics this year, we've created a walkthrough video to show you what a typical flu clinic will look like. To ensure that flu clinics are as safe as possible, we encourage residents to review the video prior to your appointment. Watch the video at ottawapublichealth.ca/flu. More than ever before, we must work together to reduce the level of virus that circulates in our community. It's time to roll up your sleeve and get the flu vaccine. Thank you. Merci.
Merci, Madame Turcotte. Before we go into questions, we'd like to play the flu clinic walkthrough video for you. Please note this video is also available in French. Veuillez aussi noter que cette vidéo est disponible en français sur notre site web et sur YouTube.
To avoid crowding and reduce lineups, Ottawa Public Health will have by-appointment only clinics. You can book for your appointment at ottawapublichealth.ca/flu or call 613-580-6744. Please arrive no more than 5 minutes before your appointment time and note that we cannot accommodate walk-ins. You must wear a mask and respect physical distancing. If you are sick on the day of your appointment, we ask that you reschedule your appointment and please stay home. This year, with COVID-19, Ottawa Public Health wants to make sure your safety is our top priority at our flu clinics. Let me show you how. Follow me. Before you enter the clinic, you will need to put on a mask. You will be greeted and screened by an Ottawa Public Health employee. Once you have been screened and checked in, you will be asked to sit in the waiting area, which is set up to ensure distancing and that you are sitting with members of your household. You may want to bring a small activity for the kids. An Ottawa Public Health staff will tell you when a nurse is ready for you. The nurse will ask you some questions before giving you your flu vaccine. Once you are finished, you will be asked to wait 15 minutes in a designated waiting area. Thank you for joining us today on our Ottawa Public Health Flu Clinic walkthrough. We are eager to vaccinate the members of our community safely and see all of your smiling eyes. See you there.
A link to the YouTubes will be sent, the YouTube videos will be sent to you right after this media avail. On va envoyer les liens vidéo YouTube à tous les participants après la disponibilité médiatique. I will now invite each media agency in reverse alphabetical order to ask your question. Please remember you have one question and one follow-up, and that today's media availability is focused on the seasonal flu. For any COVID-19 specific or other topic questions, please do reach out to our OPH media inbox. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question et une question de suivi. Un rappel que ce point de presse est dévoué à la grippe saisonnière et toute autre question reliée à la COVID-19 ou autres sujets peuvent être envoyés au courriel des médias de santé publique. Alors, nous commençons tout de suite avec TVA Gatineau, Ottawa. Amanda Moissan, vous pouvez y aller. Alors, je ne vois pas TVA Gatineau. On va passer Radio-Canada. Roxane, c'est à vous.
Oui, bonjour. Il y a quelques pharmaciens, médecins qui parlent de délai pour recevoir les doses de vaccin contre la grippe. Donc, je me demandais combien ont été commandés et combien ont été reçus jusqu'à présent et est-ce que c'est suffisant?
En fait, ce qui est important de comprendre, c'est la distribution du vaccin pour la grippe vient de la province. Donc, la province, la pharmacie provinciale envoie les différentes doses dans les départements de santé, dont Santé publique Ottawa. Et à ce moment-là, nous, on redistribue aux différents médecins. Première livraison de vaccin qu'on reçoit, c'est une livraison automatique. Donc, on n'a pas de contrôle sur le nombre de vaccins qu'on reçoit. Évidemment, on reçoit des vaccins au fur et à mesure que la saison continue. Et en retour, on fait la même chose pour les médecins et les différents fournisseurs de vaccins dans la communauté. Donc, la première livraison qu'on reçoit, on s'assure de la distribuer de façon égale à travers les différents médecins et fournisseurs de soins dans la communauté. Et ensuite, à mesure qu'on reçoit d'autres livraisons, on est en mesure de les distribuer dans la communauté. Pour ce qui est des pharmacies, eh bien, les pharmacies reçoivent leurs vaccins directement de leurs fournisseurs privés. Alors, Santé publique Ottawa n'est pas impliquée dans la distribution pour les pharmacies.
Donc, est-ce que c'est possible d'avoir des chiffres sur le nombre de doses que vous comptez recevoir et que vous avez déjà reçues? Et l'Ontario parle de la plus grande campagne contre la grippe de son histoire. Est-ce que c'est le cas aussi à Ottawa?
C'est sûr qu'on s'attend à, comme je le disais plus tôt, on s'attend à un achalandage accru dans nos cliniques. On se prépare pour être capable, pour être en mesure de vacciner les gens qui veulent le recevoir. En termes de doses distribuées, je n'ai pas le chiffre avec moi, mais c'est quelque chose qu'on peut fournir. En termes de doses qu'on va recevoir, évidemment, on est un peu tributaire de ce que la province peut nous envoyer.
Merci.
Merci. The next question will be from the Ottawa Sun. Taylor Blewett, please go ahead.
Hi. So I'm wondering, first of all, how many people OPH is actually aiming to have vaccinated this year? And are you still aiming overall to see 70% of Ottawa's population vaccinated?
Yes, we are preparing for a very busy flu season, and we are preparing to vaccinate as many people as possible. So that's why we're opening our clinics 7 days a week to make sure we get that extra capacity while still maintaining all COVID protocols.
Sorry, I just didn't hear specifically, like, do you have a specific number of people that you're expecting OPH to see vaccinated? And like, is that 70% number still explicitly what you are striving towards?
We are aiming to that 70% of the population is immunized against the flu this year, but that would include all the different providers. So that would be Ottawa Public Health, pharmacies, the physicians, and all the other providers in the community. Ottawa Public Health is, as I said, preparing to vaccinate more people. We are hoping to, we have the capacity for about up to 1,500 people a day to book an appointment in our clinics. So hoping that we can vaccinate as many people as possible.
Thanks so much. And sorry, how long will the clinics run for? Just real quick.
Well, for as long as they're needed, we will continue vaccinating people for as long as it's needed.
Thank you.
Thank you. The next question will be, la question, en fait, c'est le droit. Julien Paquette, c'est à vous.
Bonjour. Juste avant de poser ma question, je vais clarifier un chiffre que vous venez de donner en anglais. Je ne suis pas certain d'avoir bien compris. Vous êtes en mesure de vacciner jusqu'à 200 personnes par jour?
Non, 1500.
1500, OK.
Oui.
Je suis content d'avoir clarifié ça, parfait. Et ces cliniques-là, dans le fond, ça commence à partir de la semaine prochaine. On cible, on espère se rendre à 70% de la population. Ça peut prendre combien de temps, dans le fond, à ce rythme-là pour atteindre cet objectif-là, dans le fond?
Écoutez, les gens, c'est sûr que Santé publique Ottawa va vacciner une certaine partie de la population. Des gens vont choisir de le recevoir chez leur médecin, des gens vont choisir de le recevoir à la pharmacie. Habituellement, le gros de la vaccination contre la grippe, c'est à l'automne. Donc, on parle entre maintenant et le temps des fêtes. Habituellement, c'est ce qu'on voit par les années passées. Maintenant, cette année, on espère de garder nos cliniques ouvertes aussi longtemps, comme je le disais plus tôt, aussi longtemps que les gens voudront recevoir le vaccin.
OK. Donc, ça pourrait aller jusqu'en début d'hiver, janvier, février.
Tant qu'on a des gens qui souhaitent recevoir le vaccin, absolument, on veut garder nos cliniques ouvertes pour être sûr de vacciner tous les gens qui veulent le recevoir. Mais comme je le disais, habituellement, les gens reçoivent le vaccin avant la période des fêtes.
Parfait. C'est bon. Merci beaucoup.
Merci.
Merci. The next question will be global news. Craig Lord, please go ahead.
Thanks very much. So there are, as you said, many options available to residents to get the flu shot. But if people are having difficulty maybe booking an appointment with their physician or with OPH, is it an option to go maybe outside of the city to one of the nearby villages or other cities to get a flu shot, or can Ottawa residents only get them in Ottawa?
The program is a provincial program, so it's a universal program in the province of Ontario. Of course, we would recommend that people from Ottawa get their vaccine in Ottawa. I'm not sure what the policies would be outside of the city of Ottawa, but the program is provincial, and so anybody who works, lives, or studies in Ontario is able to receive a flu vaccine.
Okay, and as we mentioned, this is kind of a double season with COVID and the flu. Are there any surefire differences in the symptoms between the flu and COVID that people could use to tell the two apart? Or is it a matter of say, getting a COVID test or a diagnosis for the flu to actually be more certain about that?
So I'll respond. I would say very clearly that, as a physician who sees patients in an urgent care setting, there's no way to tell the difference between these respiratory viruses based on the symptoms, and that's really what the challenge is with COVID. If someone has flu symptoms this season, we have to assume that it's COVID, and right now, if someone has flu symptoms, the likelihood is that it is COVID, not flu, because we haven't approached the flu season yet. So we have to be very cautious. There's a lot of information out there about differentiating colds, flus, and COVID based on symptoms. I can tell you as a physician, that's not something that I ever attempt to do. This season, anyone who has symptoms of COVID, which overlaps significantly with the flu, would need to be tested.
Great, thanks very much.
Thank you. The next question will be CBC Ottawa, Joanne Kienlo. Please go ahead.
Hi, thanks. I was just tweeting what Dr. Arnason said, so I was caught off guard a bit. I'd like to talk, I think you mentioned this in French, I'm not sure, I believe you did, but talking about the availability of flu shots. We want 70% of the people vaccinated. I think the Ontario average last year was 30%. So although the province ordered 700,000 more vaccines, that doesn't come to 70% of the provincial population. So can you please talk to us a little bit about the supply of the vaccine? Thanks.
So we receive our vaccine from the province, as I explained earlier, and we in turn will distribute it to physicians and different providers in the community. The first shipment that we get is what we call an auto shipment. So it's a shipment without us ordering a specific number of doses. The province will decide how many doses we receive, and in turn, we split it amongst the different providers in the community. And then on a weekly or bi-weekly basis, we do get some more shipments of vaccines, and we're able to ship it around to the different providers in the community. It takes us about a day or two to turn those doses back into the hands of the providers. In terms of the 70%, it is a target, and as I said, it includes all the different providers in the community. So our public health, physicians, some workplaces will organize workplace clinics. It also includes pharmacies. So it includes all the different providers in the community. More doses, as you mentioned, were purchased by the province this year to make sure that they can meet the demand. And again, 70% is a target, and it includes all the providers.
Yeah, I kind of have two clarifications. I know Catherine's gonna be mad at me because I'm only supposed to have one, but I just want to make sure I understand. So when you say you distribute it to the all providers, so both family doctors and pharmacies, are they getting their flu shots through OPH, or do they get them directly from the province? And then my second part is, do you have confidence that the province can supply Ottawa with 700,000 doses, which is 70%?
So for your first question, no, pharmacies get it from their private distributor. Public health units are not involved in the distribution to pharmacy. We distribute to physicians and other providers. So that's the first part of your question. The second part of your question, in terms of doses of vaccines, again, 70% is the target that we have, that we want to see as many people as possible vaccinated. We keep in close communication with our partners at the province to make sure we can order extra doses of vaccines when needed. And we, as I said, we receive doses of vaccines on a weekly or bi-weekly basis, and we're able to ship them.
Okay, thanks.
Thank you.
Thanks, Joanne. The next question will be from 1310 News. Jason White, please go ahead.
Thank you. My question is, I know you mentioned about the clinics will run for as long as they're needed, but can you explain to me how you've arrived at 6 locations for flu shot clinics, and how much flexibility is there if the demand ends up being even higher than what you expect? Do you have the flexibility to set up a 7th location or an 8th or so on?
Yes, so in terms of number of locations, we looked at spreading them across the city. So to make sure that there's access at different points of the city. We also needed to make sure we can secure venues that are big enough so that we can maintain all the COVID protocols and maintain physical distancing. And we do have contingency plans if the demand increases and we feel we need to open in other sites. We do have contingency plans that would enable us to increase our capacity.
Okay. And who would you like to see at these clinics? Because there are many venues I can go to get a flu shot. I'm fortunate I have a family doctor. Should I go to my family doctor? Should I go to a pharmacy and not an OPH flu clinic to save that for someone who doesn't have a family doctor? Can you sort of explain to me like who should show up at these flu clinics run by OPH to ensure that as many people as possible can get their flu shot?
I would say this comes down to personal preference in terms of getting your flu vaccine at the pharmacy, getting it with your physician. It's always better to get it from your primary care. You can, they have your health file. But if people are not able to get it at their family physician, absolutely they can come to our clinics. And as Dr. Arnason was saying earlier, we have opened some of our clinics to family physicians who were concerned about providing the flu vaccine in their office. So anybody can come to our clinics. It's open. Anybody over 6 months of age can receive the vaccine, and we will welcome them in our clinic.
Okay, thank you.
I'll just add that yeah, I think primary care providers are going above and beyond this year, making a lot of efforts. We're seeing wonderful things being done by primary care providers to keep their staff safe and vaccinate people through other clinic models. And so I would check with your primary care provider if you have a primary care provider, because many of them are really doing an extra effort to get their patients vaccinated. And similarly, they might be participating in one of our clinics that's a joint clinic, and there would be a specific day which people would come to see their own primary care provider at our clinic. And the other thing I'll mention is that pharmacies are not able to give vaccines to anyone who's not 5 years or older. So you know, we do encourage the families with young children who are a high risk group, the 5 and under group, to look at these clinics as an option, because we recognize they can't get it through the pharmacy.
Thank you for that.
Perfect. So this is all the time that we have for today. Ceci conclut le point de presse d'aujourd'hui. Thank you all for joining and have a wonderful Thursday.
Thank you.